party, and then I'm sorry, you guys surprised me. I wasn't expecting anybody to be here tonight. I actually picked a topic that most coders like me like void, and they be watch them. But I guess if you can withstand the hazing, the pressure, and the tremendous amount of administrative burden, then compliance might be a good fit for you. Well, that did come off a bit scary, didn't it? And well, let me unsay that. Compliance is truly exciting and life changing. It's like riding a roller coaster that takes you underwater for a spiritual view of the magnificent ocean and then through a powerful volcano. See, isn't that a better narrative and more pleasing description? Yeah. Okay.
In someone's world.
Compliance involves the regulatory aspect of billing and coding, generally speaking. True story. One of my first jobs was working at a teaching hospital for a compliance team supervisor named Rose. I didn't wear glasses when I started, but over time, she blinded me with compliance. 3, 2, 1. Grown. All right. So these kinds of roles typically take a serious demeanor, which obviously I don't have, and a poker face, which I don't have that either. But because compliance roles typically hold the ethical line in the office facility, you kind of have to have that kind of serious stance. So there are many different types of compliance jobs, and we have 3 panelists today. We have Keisha Wilson of KW Advanced Consulting, and she'll be discussing her perspective as an outpatient and inpatient consultant. We have Nicole. Sorry, I've got to put the banners up. First banner for Keisha. So Keisha is the owner consultant of KW Consulting and is also a VIL instructor at. Did I put that on the wrong one? I did. Wow. Keisha is not a VIL instructor.
No, you're right.
Oh, was I? Yeah,
Yep.
instructor at the APC. Next, we have Maya Turner, who is a coding and compliance audit aficionado at Franciscan Alliance Inc., and also an SME at Healthcare Inspire. And last but not least, we have Nicole Snyder, who is who's a certified outpatient coder, CPC, CPCO, which is a compliance officer, coincidentally, and CPMA. She's also on the AAPC Chapter Association Chapter Advisory Board, which is a new way of saying I'm fancy. She's also an audit and compliance specialist at Deaconess Health System. And lastly, you have me, CPCI, not a compliance officer at all. No.
Yeah.
So again, we're going to be talking about compliance, and I'm just going to let these ladies run with this. So I'm going to lead off with a very general question. What is compliance and what is the intended outcome? Nicole, go.
Oh, gosh, you start with me first? So, I mean, honestly, and I've thought about this a lot because I have been involved in compliance since I started as a coder, probably as a biller, actually, not as a coder. Because everything we do has some aspect of compliance to it. I mean, everything we do, from registering a patient to sending out the bill. If one thing's wrong, that's a compliance issue, and not necessarily how it gets paid, but how we report that information. So it's just something that we all touch it, and we just don't always realize that we're touching it throughout that process from A to B, or A to Z, I guess, really, because there's a lot more between there than A and B.
All right, let's just go in a circle. Keisha, you want to weigh in on what your idea of compliance and the intended purpose of what you do for a daily job is?
All right. So agreed with everything Nicole said, because for me, initially, like, my role in healthcare started in front desk. So understanding being compliant, right, from the front desk with calling out patients, demographic information, you got to be careful with all of that. But, like just to sum it up, is being following rules and regulations and policies that your organization or physician practice sets in place, whether it's front desk, billing, coding, auditing, managerial, leadership. We just have to follow rules and regulations. Are we doing it? And if not, what can we create, like policies and procedures, and what kind of education can we provide? So that circles in what I do daily on a basis. For a daily basis, I did it. I've worked in compliance for organizations, big and small, and then ventured out on my own. So I do it, go in and teach. I see what kind of policies and procedures they have set up, and if not, how can I help them and assist them? And if it's a new practice that's starting off, we're starting from the ground up. So that's perfect because now you can help them. Initially, instead of coming in and finding a problem, you're able to deal with certain things and create policies before anything starts.
Maya, your turn.
Oh, it's my turn. It's my turn. Um, um, I think compliance is all about what's the word I'm looking for? It's all about relaying information, right? It's all about relaying information that may not have been known, right? Because a lot of times, I think we all can say on this panel that we've all worked, all areas as it relates to physician practice, as it relates to, the entire revenue cycle process. And I think part of the biggest thing that we need to understand is that, like Nicole said earlier, compliance is part of everything. But because compliance is part of everything, it may not be known about why it's part of everything. So that education piece comes into play, right? About why something isn't right, or why you do it this way, or why you do it that way. Because with everything, there is a cause and effect. And if something has this way, this is the effect of, or the cause of why this isn't right. So it's about relaying that information. It's about education, and then relaying what you learn or what you know to others so that they are more cognizant of rules that are related to keeping payment. Because at the end of the day, when you start at the front desk and you post the payment, and then the payment of patient responsibility, or the patient responsibility is transferred. It's all relative. It's all relative. I'm actually speaking about that in health, not HealthCon, Compliance Institute for HICA, understanding the revenue integrity, the revenue cycle process, and then the coding compliance risks that are in between the cracks. And if you don't understand every piece of the revenue cycle management and how that integrates with compliance and how you can keep the money versus self-reporting or being, audited, then, it becomes a risk and for everyone. I mean, we want to keep the money that we make, not because, you changed the data service when it didn't happen. You can't do that. What do you mean I can't do that? That's compliance, I mean, compliance is a daily question of what were you thinking and why didn't you ask? So,
And do you like orange?
right. Or non-negotiable jewelry, right? So I think that's all, it's all about making that, visible, and be transparent with your position about what the rules and regulations are, and holding your ground when somebody says why or how come or that kind of thing. So
Yeah, I like that Nicole started with the front desk because a lot of people don't realize the
mm,
big compliance risk starts at the front
at
desk.
the front desk. Yes.
Registration. You got to get the right patient to start
Hello.
off with.
Oh, wait, you're not. No, no. I'm so. But don't you want to be? No.
Not today.
No.
Are you telling me that you're not Mr. Blank Blank that came in with that problem in that area?
No, I'm not. Yes, exactly.
I mean, and there have been times where I've actually seen where people use other people's identity to get service.
Yeah.
So
Yeah.
the issues become, OCR related, and HIPAA compliance and verifying eligibility with the person that they are saying that they are. That's all compliance, right? Because you have to prove that the person who's getting the service is the person who has proven their identity to get the service.
Mhm.
I mean, and that's part of compliance because it's part of rules and regulations.
That's what that driver's license is for. When they want the driver's license and the insurance card, it's not just because they want to see your driver's license. It's because they want to make sure you really are
Who
the
you say?
person that's getting this insurance benefit.
Yeah. You'd be surprised how much fraudulent information goes out, especially when it comes to insurance and services going to the wrong people. And this day and age, I think it's really problematic because people want help and they don't know that there's SDOH. They don't know that there are resources that are out there that can help them. So,
Agree.
So let's talk about the difference between inpatient compliance and outpatient compliance, or is there any difference at all? Is there any, or are they one the same? So let's start backwards. Let's start with Maya, and then work counterclockwise.
okay. I'm going to say this without saying a lot, but you can't say inpatient services without saying a lot because inpatient services is a lot. You have outpatient departments, you have physician-based departments, you have facility-based services, you have departmental services, and then you have the specialties that are within those departments. I would say because you're dealing with a broader scale, there's state regulations, there's a lot of different things that are involved with hospital-based compliance. And as it relates to physician compliance, you're really dealing with the physician practice and the office and the spectrum of the services that are related to the office. But what the hospital is very much so a broader base because they're more compartmentalized and they have different cogs in the wheel where the physician doesn't have as many cogs. And so it without saying a lot, there's a lot more to hospital because there's a lot more cogs compared to physician because they're are dealing with just the practice itself and regulations related to how they have a workflow in their practice.
Keisha, outpatient versus inpatient, any major differences that you've identified?
So I would say a little similar, right? Depending on the organization, inpatient versus outpatient. If it's a teaching physician, if they have residents, right? Some organizations with inpatient may have both inpatient physicians that's working on the inpatient side and outpatient side. So ensuring that they understand the rules and regulations and the path guidelines when it comes to residents. I think when I hear in and outpatient, that's like the first thing I think about residents and making sure that they understand, as well as the attendings, what documentation entails, what does it mean to be an attending, how does your note need to look, what does your attestation need to look like, that you just didn't agree with the resident's note, right, that you also physically saw the patient. And so when I think about in and outpatient, I think about their presence and them needing to be there, and what does direct supervision look like versus general supervision. Like, these are things that's come into my mind when I think about them. As well as how big, if it's a physician practice, if it's a group practice, how big is the practice, right? And do they understand rules and regulations? Are they updated on guidance? Oftentimes, I figure some organizations may focus on the outpatient setting a lot and ignore the inpatient setting. Well, not ignore, but don't put too much attention into it, or vice versa. And I feel like they both need as much attention. There's so much risk when it comes to both, because outpatient setting, they're doing a lot of procedures now that sometimes they were doing in inpatient. So we talk about malpractice and all kind of things that are floating through my head. And then I'm thinking about incident to and split share. Like, I'm thinking about it, and I'm thinking about compliance, because what do? We show up in places. You don't know compliance is coming, and we do like a spot check. Like, hey, are you here? Are you following the guidelines? So I think it's important for organizations, if you have both, that you're understanding both and you're understanding the rules and regulations when it comes to one versus the other. And what does it look like, so you don't get it confused.
Yes.
I see both shaking there. Everyone's like,
I'm just like, yes, I agree with all of that. And I see that I was looking at the questions and I saw someone saying that compliance for hospitalist providers. And Keisha mentioned that a lot of people don't, especially in the past, I have to say, I've been doing this too long, that I have too much past knowledge as well. They didn't put a lot of emphasis on the physician services provided in the inpatient, outpatient world. It was more office. So if it's office, we need to make sure everything's compliant and everything. But when they're doing it in the hospital, it's like, well, we saw the patient. That's really their main concern, is getting there and seeing the patient. Well, things have changed over the years when now we have hospitalists that come in. They take over for PCPs. We just have the specialists that are there. And it still falls in that category a lot. Sometimes people just don't put the weight upon those hospital visits the way they do an office visit. And it really should be the same priority. They're all the same. You're still providing a service, and it should be a compliant service. And on that side of it, you also have the hospital that is looking at that facility itself, is looking at what you're doing and if it is medically necessary. And they have their own regulations they have to follow to make sure they get paid for their services. So your documentation has to meet that and support what they're giving to the patient while they're there. Why are they in ICU for 5 days if your note says they're perfectly fine? There's nothing wrong with this patient. We're going to send him home tomorrow. No big deal.
I also think that there's a really huge difference between professional billing in the hospital and in the physician setting, whereas you're dealing with hospital facility-based services, because you have hospitals that have nutritionists, you have hospitals that have transport, you have hospitals that have all these different cogs. That's what I meant by cogs, because you have also the physician documentation who services the patient, both in the facility as well in the physician practice, where they're both providing a professional service. But then you have the hospital, which has all of these different compartments and people that are employed by the hospital. Then you have the director of nursing, the Don, we call him the Don. And then you have the assistant Don. And then you have all of these different compartments that also have their own compliance regulations and rules, HVAP and state regs and all these different things that, make a regulatory environment for hospital systems and hospital-based. Whereas opposed when you're dealing with professional services in both the facility and the office, there are still documentation requirements, but the requirements from a professional standpoint in the facility and in the office, it's all about documentation and what happens on the day of, rather than the hospital who the admission is from admission through discharge, right? And that's considered the encounter where a physician is day to day. So I think those things kind of make a difference too on compliance and what happens that day versus the facility, which operates really different. I always say, when you're trying to look at documentation requirements and you're trying to get something fixed, you got to go through so many departments, especially if they use Epic, because you got Epic Resolute, and then you got Epic this, and then you got Epic, ambulatory, and then you have that. And you're just like, oh my gosh, is there one person that understands everything and that knows what we're dealing with and which hospital, which department needs to go through to get this right? So I think it's a conglomerate of different cogs in the wheel if you're dealing with professional services versus facility employees that have different components related to compliance.
All right. Well, so now that we've gone through that and we've pretty much scared away anybody that wasn't serious about compliance, we have the serious folk here now. So let's talk about what you need to know. And all right, so what's the most basic rules and laws that you should know and have committed memory in order to kind of function on a daily basis? Like, I know there's a lot out there. I remember that's the one thing that kept me away, is like there was like so many laws that you had to memorize. What's the truth behind that? Let's go with Nicole.
Know your resources. Know your valid resources, not just any resource. But it's hard. It's hard to remember every single thing that's out there, but you can be familiar with a lot of stuff and know, oh, I know where to find that answer. I may not know it off the top of my head, but I know where to find that answer.
Right.
And again, like I said, I've dabbled in compliance pretty much since I started as a coder. And just the knowledge gained over time, I can't put into I just can't put into words. I can't tell, because everybody's like, how do you know all these things? I'm like, I don't really know all these things. I really don't. I just know how to find them, or some things I have done and I just have the experience that I've dealt with it personally. I don't know it. I just did it, and now it's stored in my brain forever, because until my hard drive crashes, and then I'm in trouble. But right now it's still there. I don't know for how long, but it's just kind of one of those things, people ask me a question and I'll have to think about it. I'm like, something about that sounds familiar. And then I'm like, oh yeah, I remember that one time we had this happen. And I can associate it with something, and it may not be exactly the same, but it's very similar. But, the biggest thing is just know what OIG says about compliance. That's probably the best thing out of all of it. It's very simple. It's very basic. They don't really make it that difficult. If you decide to take the CPCO exam, you have all the references you need. It's basically a couple of pieces of paper and no books or internet or anything like that. And that's all you have to take the exam. So it is a lot of experience that falls behind that. Knowing, just having done it and knowing it, I think.
Yeah.
Yeah, I agree 100%. I think a lot of it is resources and research.
Yeah.
Even when you think about regular coding or auditing, you won't know everything, but it's knowing where to find it. And you have to be willing to research. And I think that's where some people get scared. And you can't be. You have to look. You won't know everything. You can know some basics, right? They're always going to throw those wonderful Stark and anti-kickback laws and different stuff. But as Nicole mentioned, examples that happen, experiences, you're going to remember certain things, like, that I remember that. Let me go look here. OIG, as she mentioned, they send out lovely alerts. I think signing up for their newsletters is amazing. That's a great start. They came out with their compliance guidance in November, 91 pages, but printing them out and reading it over time so you get familiar, and then you just remember where to go. And then talk to your colleagues. Like, we all talk to each other. Hey, what do you think about this? Where can I go? What do you suggest? Does anyone have a compliance plan that you can share that I can maybe tailor? So I think not being afraid to communicate with each other, but knowing where to go to look for your information is important, and don't be afraid. This CPCO, as she mentioned, is great. And then we sat in I sat in her boot camp that she did for like an hour. Well, it was 4 hours, I'm sorry. But that was like a great refresher, because as Nicole mentioned, there's no books. You just have a PDF that's there, and you really have to remember and use examples when you're sitting for that as well. And then there's other compliance courses out there that can help you along the way.
I also think that one of the biggest things that I come across is being able to interpret guidelines and relay them so that people can practicalize it or make it chewable for them to apply. And I think that's where education comes in. When you're able to read the information, interpret it, and make it practical for the physician to understand it, and not afraid to be challenged because you're giving them a point of reference. Standing firm in how you interpret something is also important, because that's why you are in compliance, because that's what your job is, to know what's happening. And if you don't understand what's happening, or if you're not very confident of how you relay information, then you're always going to have pushback. But if there's documentation to support, there's OIG points of reference, you do tip sheets, you do blah, 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 and they come to you with answers or with questions for you to provide an answer, then stand firm and be confident that you've done your homework and that they should trust you because you've done your homework and you know the answer.
All right. So now that we've established that it's not necessary to memorize the whole HIPAA law, as I did recommend to a couple people. So if you are doing that, you gotta stop. You don't need to memorize the laws. Sort of unnecessary. And I truly apologize, Christy. So let's talk about daily roles. So at compliance, what do you do during your day? Like, what's your daily routine? Let's start with Keisha.
Okay. So I want to say one more thing about the resources and references. We know we mentioned the OIG, right? But you have a CMS website. Like there's some ones that should just be starred on your computer because we just go to them. So you have CMS, you're going to go on HHS as well. You have the OIG, but then you also have to know, this can stress you out a bit. The Federal Register, when it comes out, it's thousands of pages.
3,000 was the last one.
Yes. If you have your at-home computer, you might want to print it somewhere else because you're going to run out of ink, or have an ink on standby because it's a lot of pages. And you're not going to read through it all. You can keep a PDF version. Some people like paper in hand. As you can see, my little library, I have like tons of books. I like paper. I feel bad. I don't want to kill trees, but sometimes it's good to flip through pages and highlight and tab them. It just helps better. And I do a PDF too. So some things you just want to know where to find things and read. And as Nicole mentioned, the resources, and Maya said you just know where to go. So I just wanted to mention that as well. There's lots. And we didn't even get into the federal versus state guidelines. So if you live in a certain state, go on your websites and know that, okay, the feds may say one thing, but you got to go back to your state policies. And that was one thing I'm thinking about telehealth right away that comes to mind.
Mm-hmm.
With compliance and the whole realm. We had to look at what they said, but what did the state guidelines say? And that was just fun for us. My hair looks black, but it's really has a lot of gray, and my hairdresser loves when I come. She's like,
Oh!
yeah, because there's a lot of stress. So I want to mention that. So back to John's question. So my day-to-day is, of course, consulting. It can vary, where some organizations, smaller physician practices, may not have a compliance program, or they may not be a part of a hospital, because here in New York, there's a lot of physician-based practices that are being taken over by bigger hospitals.
Right.
So now they have a compliance officer that they report to, and they may be reporting a little differently. But then there's some clients that never, had a training or education. So I go in and I train, I look at their policies and procedures, I see how I can help. Training and education is the biggest thing that I stand firm on and I believe in, because that's the heart. You need to train and educate on what's going on. Some people don't even know that there was a 2023 update with the E&M, so you can only imagine what billing might look like, which I see everyone smiling, so you're probably cringing inside. So it's like that. And then as well as I have some clients that are now starting off on their own. So they may need some type of compliance guidance. And it started off maybe initially as medical auditing, and then they need more regulatory. And that's initially what kind of pushed me to the compliance certification, because you want to be able to provide a certain level of service to your clients. And if not, then you have colleagues to recommend them to. So that's, my day is always full of a lot of education, training, leading, research. And why I say that is because I had some clients and they were starting a practice. And it was maybe a month of research because it was different. It wasn't even in the United States, it was overseas. So now you're talking about compliance in other countries and understanding their country laws and their state regulations and what did they follow, and not necessarily HIPAA and GDPR. So it's sometimes it's a lot of research, and it goes back to what does my client want at the time. So that's my day in compliance in a nutshell.
Oh.
All right, so it's a coin flip between Nicole or Maya. Who wants to go next?
You first.
All right.
Well, I have to say first, I'm fascinated with the international compliance. I'm like, oh, I need to know more about this because I haven't been involved in anything internationally, but that's interesting.
Oh, it was stressful. I thought like the United States one was like but this was like a different walk in the park where I was like on a lot of coffee and late nights.
It's good to
Did you
know
tell
that.
them that you needed a beachfront condo, and all of that, and
Yes.
long-term stay at the Ritz?
Right.
Everything and more. And more. Yes, and my write-up was like 20 pages after that because it was a lot,
Yeah.
It's a
I'm
lot.
sure. I can't imagine learning that. That would be crazy. So we'll have to discuss that more at another occasion. So for me, I work for a large health, well, I say a large health system in comparison to some health systems. It's really not that large, but compared to what we were when I started there 20 something years ago, it is very large. It has grown and picked up a lot of smaller hospitals in the region that we live in, and it's to help them, provide better care and service for people locally. And so they don't have to come to us to have their health care. They can stay in their hometown and have their health care because, it's nothing worse than traveling when you're sick and your family having to travel to come see you when you're sick. I had to actually do that because I had a family member had to go to a larger hospital to have something done, and we had to drive 3 hours to go back and forth. So it's no fun. So I know some people call it, I've heard people refer to things like that as gobbling up other places, but it's really not. If it's done appropriately, that's not what it is. And
Right.
I have to say, my health system is definitely not gobbling up anything. They're there to help and help them provide good services. So in that process, we do have a lot of, we have a lot of rural areas because I live in, we didn't mention where we're at, but I'm in Southern Indiana, and we have Kentucky and Illinois. So we have a lot of rural areas.
Mhm.
And they don't have the funds to have compliance people. They can't have a compliance person that works in their office for these private practices and things like that. So they're just trying to see their patients and take care of stuff. So we run into some issues. So there's a lot of education that happens. We spend a lot of time doing that, but our health system they have really embraced the idea of education for our providers and teaching them coding and documentation and things like that. So I spend most of my time working with that, with the coding department, with other parts of compliance. We're just a small piece of the compliance within our health system. It's more of just the professional piece of that and not outside of the corporate piece. That's a whole nother department. I report to them, but I don't, or I report my stuff to them, but I don't have to worry about a lot of things that they worry about. Thank goodness. My stuff's enough that I don't want to have to also worry about theirs as well. But we do audits. That's part of our process. Our department does all of our physician audits and APP's audits throughout the year. We have certain guidelines and rules we have set up for ourselves that we do, and how we report it out to those practitioners and their management as well. And within those other health systems that that we're working jointly with, we work with them and their compliance people, because some of them do actually have some of the facilities we brought on have their own compliance people. So we work with them as well and try to keep that information together. And we have this one big giant compliance, all of it together. We're a big, seems like we have a lot of people, but we're probably not even remotely close to what some facilities our size have for a compliance department. But we are responsible for all the education, and we try to, and I love that part of it. I'm so glad that they embrace that, because again, like Kesha said, you got to have that. If you're not teaching them how to do things appropriately, how are they supposed to ever know that it's not right if you don't tell them? Right. So it's wonderful. We've always kind of been that way, but it's really in the last, I'd say the last 10 years, it's become a real high priority. So it's very nice to see that health systems notice that. And it's not just us, it's everywhere. People are noticing that because it is very important. It's not just about getting paid, it's about doing things right. So,
Right.
How about you, Maya?
Okay. For me, and what I do on a daily basis is I have the heroic efforts of educating physicians and coders about coding and making sure everything is right and you follow regulations and things. But like Keisha and Nicole said, it's all about education, right? But I used to I used to audit the physicians, and then I transitioned into a main educator role. And so, with all of the wonderful and confusing and engrossing changes like the split share, the G2211, or all the new codes that have come out, then there's decisions on how that should be documented, and coordinating that with Epic, and then coordinating that with blah 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 blah. So there's a lot of different components and wheels about education and how you're coordinating how it should be done, documented, and working with department heads and making sure that it's done correctly by auditing it. And then there's a work queue, and then you look at the work queue and say, "Wait a minute, why is this guy billing G2211 with all of these procedures? Hello, this is wrong." And then you got to say, what's happening, and educating, and then you got to hear, "Well, I didn't know what he was talking about," and then you got to stand firm and say, "Well, this is what it says here, and you're going to listen to me." And I would say listen. Well, I should say listen, because if you don't, it's going to be wrong, right? And then you also you also have to relay that if you don't listen, then you could be a target, and that's the last thing you want them. And if you don't have a means to a non-compliance type deal, you have to relay that. Well, how do you know, and how does Medicare know that I have spent 60 minutes for all of my patients and I'm only here 8 hours a day? They do what's called time audits, and if you only have 8 hours a day and you spent 60 minutes and you saw 20 patients, they add that up, and if it's wrong, they're going to take it back. What do you mean they're going to take it back? Okay, come here, let me show you. You see this? And so it becomes really about relaying information, relaying the the rules that are related to keeping the payment. And if you don't keep the payment, you know that they're at a risk. So it's all about really kind of interchanging all of that information and filtering it to relay it to physicians, and then um, give them the whole rundown so that it's chewable, they understand it, and then when you follow up, it's right. It's not always right. Sometimes it takes 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 times before it gets right. But the idea is to stay with it and stay consistent with it and not change your story because they want you to change it. You got to stand firm when you educate.
Do you find that a lot of providers run from you? Like when they see you coming down the hallway, do they duck in dark alleyways just to get away? I mean,
Here she comes, here she comes. I don't think so. What I think is depending upon your personality, because if you're dealing with physicians, you got to have a demeanor to listen and respond. And if they see you coming, they're going to want to know either A, what they did wrong, B, what they did right, or C, how they can fix it. If you have the right rapport with your physicians. If you don't have the right rapport with your physicians, then they're going to run. But it's not about a running type of situation. It's really about a relationship. And if you have a relationship with your physicians, then you become a viable source of information. Because at the end of the day, it's about becoming a viable source. And if you're not a viable source, then they're either going to run away from you or they're not going to listen to you. So you need to create a rapport so that they are respectful and welcome when you come. I mean, I've been doing this for, Nicole, how old you say you were? You're 52?
21. She said 21.
21, yes. I started doing this when I was 12.
Right. I've been doing it since
And that, folks, is part of the labor laws.
Right.
No, it wasn't back then.
Yeah, exactly.
child loss. No, but no, seriously. I've been doing this for a long time, and I believe that if you talk to people like they're people, you're going to respect it. We did Jennifer and I spoke with CJ Wolf, and at the end of the day, it's all about communication. Communication is when two sides can have an effective conversation, understand each other, and walk away understanding each person's point of view, and being able to move forward from that, right, or build from it. And I think that's the key. If you're doing it for a long time, you understand you have to have a demeanor of hearing, responding, and doing something about what you hear, because people want to be heard and they want to be understood. So if that's the case, then you have something to work with, and then people are very supportive of you, and they become respectful of what you have to say.
Yeah, and I think putting out fires, is another one when they come up. Communication, I agree wholeheartedly. People always laugh because they're like, I have such a quiet tone, and calm tone, which is good because initially I was going to school to be a social worker, and I decided to take a full circle and come into coding and auditing, but that set the foundation with how I communicate with others.
Yes.
So although it's like quiet and a calm tone, there are times when I have to let them know the seriousness of what's going on. And so don't take the quiet and calm tone as I don't know what I'm talking about, that I'm not coming with facts and research and resources to let you know this is what the OIG said, this is what HHS said, this is not what Keisha said. There will always be links, and people will always remember you for the research and the rapport and what you did and the resources you provided.
Yep.
But then also, as you mentioned, communicating. So letting them know, like, if there's an issue, you can talk to me. We can communicate. I remember one education I did because initially in organizations, I worked in compliance as well. So that's how me venturing out on my own happened in different roles, right? Auditor first, compliance manager first, interim director after. And you go out and do a lot of education. So one physician in particular was like, Keisha, because of your tone, I like you. But if it was anyone else, I would not listen to them. They don't want to know that they don't want to be told that they're doing something wrong.
Right.
Right. So you have to approach it as we're a team. You didn't do anything wrong necessarily, but this is what happens. Here's how we're going to fix it or work towards a solution.
Right.
And when you speak to them like that, they're more receptive
Right.
about what you're coming to tell them. And so, again, education, as you mentioned, as well as your tone with how you speak to them, because again, they're people. So everyone wants to be heard and listen, and they want to listen, and they want to give feedback as well. They want to know that they're just not being told, but they also have a say, or an opinion.
This is actually my topic at HealthCon is how to have those conversations with the providers to get them to listen to you. And we all seem tough, talking like, oh, we're so bad, we're so tough, but that's not how you approach that. You've got to approach it with a little bit of respect in there, obviously, because these people have worked hard to get where they're at.
Yeah.
And, their priority is taking care of the patient. That's always their priority, or it should be their priority if it's not, but it usually is their priority to take care of the patient. And
usually.
So we are there to help them with the one piece that they don't have time to deal with. So we're there to help them. We're not there to like Kisha said, to tell them what they did wrong. Like, I'm not telling you what you did wrong. I'm here to help you do better. And I'm here to and you missed D, which was change. Something changed. You forgot that in your A, B, C, and D. Something's changed. There's something new that we have to tell you about that you didn't know. So
Oh my gosh, yes, the D, the
there's
D.
that piece. So there's always something that we have to give them some kind of education, and just being mindful that they want to do it right. They just don't always have the time to do it. So they may seem frustrated and aggravated, but they're not that way at you. They're that way at the system, because
Right.
it's not our fault that it's like that. It's not their fault it's like that. Unfortunately, it's someone else's fault, and they can't be mad at that person because they're not there.
And I also think, Nicole, that and I think also when you're dealing with what's the word, opposing thoughts like operations versus documentation, and they want you to have productivity, and then that I find is probably the gleaming antagonizing point of when you're dealing with compliance, is how operations factor in on how they respond. Um, they want me to do blah 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 blah. And how am I supposed to do blah 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 if I got to do blah 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 blah? And you're telling me blah blah blah. And you're just like, well, I don't have the balancing scales to tell you how to do this and then satisfy all of the components. Because I also think, and I know this is going to start something, but when you're dealing with billing and you're dealing with revenue, they don't think about compliance. They just want the money. And they see the revenue being affected when there's something that has to be reconstructed on processes like auto release. Ugh. E&M and auto release should never go together, ever. But most organizations are going into that realm, and they're not factoring in the risk that's related to auto release. And so, when you have a provider who's doing so much and then they get auto release because nobody said anything to me because all of my charges have been completed, and you're like, well, just because it went out to be paid doesn't mean that it went out right. And then you have to deal with the other issues that could relate to things that may target, like benchmarking. I mean, I don't think we've ever either one of us have talked about benchmarking, but if what benchmarking is literally is when you compare a physician's productivity against that of other like specialties within the same area or across the nation. And what happens is if a physician falls out of what's called benchmark, they become a risk. So you have to educate, right? And because of that, and you have all of these E&Ms that are going out the door by thousands by the bucket, and they're out of benchmark. Now you got to say, wait a minute, all of these claims have been paid, and these really don't meet the mark. Well, what do you mean they don't meet the mark? I got all of my productivity. So it's a lot of different cogs in the wheel, as I was saying before. And at the end of the day, it's really about looking at all these different pieces, putting it all in a nice little basket and saying, you know what? We love what you're doing. We love all the money that you made for our organization. But let's take a look at some of the things that we've noticed when we've taken a look at your notes. This might not be a level 5 if they came in for cerumen impaction. This might not be a level 5 if they had a laceration and you did it on the same day and it was planned the prior visit.
Sure it is.
Right. But it's funny because as you're talking, I'm hearing a few things, and I see we're all instructors, so we all teach, right? When you're teaching, the first thing is when you talk about notes not being signed, and the students are like, "What are you talking about? Notes not being signed?" Like, yeah, they're always signed. You're like,
No.
that's like one thing. That's like things that we see, and it scratches our head in 2024. A simple thing is signing a note and
Yeah.
signing it on
It's
time.
compliance. Yeah.
On
That's
time.
a big compliance thing. It's like ding, ding, ding. That's one thing we see. And then also education, right? Nicole mentioned physicians, getting them together. I'm sure you guys will let me know how many of us provided education as early as like 6 a.m.
Yeah.
We have surgeons that need to be in surgery, and you need to provide education before they start because compliance is annoying them, telling them there's a risk. And I need to have
Oh, I haven't heard of that at
education
all.
right. So I thought about that when we were talking. I'm like, I'm sure everyone on here has provided some early education,
Yeah.
and
6.
that's just showing how we're trying to work with them,
Right.
and not against them.
And they appreciate that in most instances that you're willing to extend yourself. Like I have a meeting tomorrow at 6 o'clock at night, when I want to be at home, eating dinner at 6. I don't want to be at a meeting with a physician at 6 o'clock, but that's what you have to do. You have to meet the need for the physician, and they appreciate that in most instances. If they don't, then, you just deal with them.
They're probably not going to meet you at 6 anyway.
Right. Exactly.
You'll be waiting.
Or they're not going to be around long because they don't want to be with
Right.
anybody, right?
Right. All good points.
Yeah.
All right, so let's kind of switch up a little bit. So we all know that this is like a very difficult job, and
No, it's not difficult.
no. All right, so what is the easiest part of the job, and then what is the hardest part? So we can give a range of expectation of what's your best day versus what's your worst day.
I think so. I'll say the best part is communicating or meeting new people, even if it's physicians, coders, auditors. Like, it's such a wide range and variety of people that you're meeting, and just hearing what they think or what they see, hearing or understanding the perspective that they may see things, and then clarifying that and cleaning it up a little bit. I think that's one of the easiest part that I like because I love people. So even if I'm going in to talk about a serious matter, just meeting you where you're at and having that communication. I think the hardest thing sometimes is the way people perceive compliance. And yes, sometimes when they see us, I don't know if any of you have ever been in an elevator walking somewhere and you see someone looking at your ID and they're like, oh, like it's compliance, So I used to go in
Oh,
and
where my ID?
flip
Where my ID?
around so that people wouldn't see where I work, because you don't want them to fear you, but then you also want them to respect you.
Right.
So I think that's the biggest thing, getting that level of respect to know that we're here to help you compliantly follow guidelines, rules, and regulations, understand where you may be lacking, so that you can do better. And we can all do better. We don't like that type of orange. I love orange, but not that type of orange. And as you mentioned, you because you got paid doesn't mean you'll keep the money.
Right.
They can always audit, and then you have to give back that money.
And they could go back as far as they want.
Exactly. And that's the other part. Staying late past or up wee hours in the morning going through stuff because you have to get them a certain amount of records because now you have this audit. And as Maya said, and Nicole, I'm sure we've all had those audits where we're digging and we're like, oh my gosh. And once they find things, then forget it. So that's my spiel.
Okay, well, I'll go. I think the best result of a good day is when they learn and they listen, and it's resulted in an outcome of a past audit. Um, when you have created a rapport, there's effective communication, and there's a respect, and then there's a application, right, of what you're teaching, then, and you find that after you do the audit, they're not billing all fives, they're not billing all threes. I had an audit, a physician be audited by the state for critical care, and he got 100%. And that was because of the work that was done prior to, right, and establishing, a rapport. Because again, compliance is all about establishing a rapport to understand the rules, right?
That's a big deal.
That,
Critical care, 100%. Woo.
yeah, that's a big deal. Critical care, it was 100%. But I mean, again, it's not just about the one compliance, it's about working with other entities, right? To help establish, the workflow, the template, making sure informatics is aware. So it's not just one cog. The worst thing is when you establish something and someone stops the workflow because either A, they don't like it, B, they don't understand it, or C, they're limited with what they can do and it just stops. That's the bad thing, because you already established one point with the physician. Now you're trying to get the cogs in going with the next steps, right? But then if you deal with somebody who doesn't want to do it, chooses not to do it, and not really willing to extend themselves, then that's a bad day, because all the work that you've done up to that doesn't, meet its end result, which is getting it right on all ends, rather than just providing education and then, well, you told me that I need to do this, but this person says that they can't do it, and then they don't want to help you anymore. So that's a bad day. That's a really bad day, actually.
I have to say, I love teaching education, that piece of it. So for me, having that educate, and it doesn't have to be one-on-one, but I do like the one-on-one a lot better. Just because you can make more progress with someone one-on-one education. But I like the education piece in general and the research that comes with doing education. And then the other piece of that too, which I always liked about coding as well, is that everything changes all the time. And you're always learning something new. No matter what you're doing in coding, you're always learning something new. So it doesn't matter if it's auditing or compliance or whatever, there's just something changing constantly. So I've always enjoyed that. That's part of that. The teacher in me is I like to learn as much as teach. So right. I wanted to, I like that piece. The hard part, that's a difficult one for me to say, because I like all of this stuff. I even like the conflict. It's not fun, but I don't mind some conflict. If someone doesn't want to cooperate or they don't agree with things, I don't mind it as much. I don't personally like conflict in general, but I don't mind it in that scenario because I always feel confident in my resources and things like that. So, but that's probably, to me, for most people in compliance and auditing, is the conflict piece is the hardest for most people, because they don't want to have, they want everything to go great. They want it, rainbows and butterflies when they have something happen. And it's not like that, unfortunately. But so you have to be able to embrace it. And I think that's, for me, I just embrace it, even though it's not the best part, for sure.
Yeah. All right. So this is a question that I like to ask is, what is the craziest compliance story that any of you have ever, passed across your desk? Like, what's the weirdest thing you've seen where you're like saying in your head, what were you thinking? Does anybody have any really outrageous stories?
Well, I do. Me. Okay. I had, and this is Keisha, I know this is gonna make your skin crawl. I had a teaching physician, and I promise you, I had a teaching physician who was a urologist, and I was providing education regarding residency. You'll never guess what he asked me. Do y'all want to guess? He said, "You mean I have to be in there with the resident?" Would you send your child to an empty classroom with no teacher? Why would you? I was outdone. That was I said, and first I had to pause to wait for the laugh. There was no laugh. Mm-hmm. It was, well, yeah, you have to be there. Well, you mean,
That's concerning.
Yeah. It's a lot of interesting things when you find with residents and teaching physicians, and that's why they have to understand the path guidelines. Like, and the supervision that you provide. So even with COVID, we know that you were able to do supervision using audio and visual, right? Or at some point they were allowing you to do some other stuff, but we won't talk about it now because that ended. But it's scary to think that sometimes they go unsupervised, and so that's important. I
Yeah.
know, like I think during COVID, I heard something about, oh, so we don't have to go in the room, right? In the patient's room, like we can just look through the glass and see the patient. Like, no, no, no. I know we're all scared, but you got to go in the room and see the patient, examine them. If there's no virtual
Right.
capability. So yeah, yeah. It's always fun when you hear those type of stuff, and it makes your blood crawl and wonder what else is happening.
Yeah.
No one else? No better stories? Well, that was a quick and easy one because that is scary. And whenever I go to any kind of office visit or inpatient visit, if the person comes in looks like they're still in high school, I say no. Send your parents in.
Well, John, you better get used to that because that's going to probably start being more of what you notice in the future.
Yeah, some people have some great genes too, but yeah, they're finishing. I think I would say the biggest thing now, especially moving to telehealth, physicians had like bedside manner, but now you're hearing website manner.
Yeah.
Training them because there was a lot of compliance stuff that happened during the pandemic. So now you have to train physicians and residents and anyone else that's seeing patients virtually how to provide this website manner compliantly. And so introduce yourself, even if you're in web, and so it's not like a terrible thing, but it's something that, we see. I'm sure everyone has seen or heard stories about it, or even yourself, if you're having some form of telehealth then that you can say happened that had you scratching your head.
Yeah.
All right, so let's get back to some education, some foundation. So, if a coder wants to learn compliance, where should they start? Like ground zero, what's the best place to learn how to work this?
I would say the CMS websites. I think that because that's a government payer, understanding government payers and how they work, especially as it pertains to their practice, and then being able to interpret the rules because a coder has to know NCDs anyway. Well, I won't say NCDs, but if they're a procedural coder, they have to know the P2Ps and they have to know regulation as it relates to what they can and cannot do. I think that's the biggest thing to me. Understanding how to utilize CMS website. I think that's the first thing that they should understand how to use. That's at least for me.
I think, oh, and I just had another thought too when we're talking about the scariest thing. I think Incident 2 guidelines is another one that comes up often
Yeah.
when you talk about scary things in compliance. So following those, understanding the rules when it comes to being in the same office suite, know that compliance does show up if they feel like you're not following the guidelines. They do office visits and look for schedules and look to see who's covering. So that was my other thought as I was sitting there and listening to Maya too. But research. My biggest thing with going into compliance was researching the roles, the various roles, understanding them. Once I knew I wanted to audit, I looked at the requirements, what was the years I needed to be before I went into auditing. What certifications do they need? What organizations provide these certifications? I printed them out, compared and contrast which ones, prices, what did they offer, jobs, roles, like, you're looking on the postings and what do they want? What is the job descriptions? I think that helps. And then talking to other people, networking to see what was their experience like, how did they get into these roles? What did it take? And then going forth and taking the leap, but have a clear goal. Because I always say all of my certifications were intentional when I went into auditing. Like this last one was intentional. I wanted to service my clients like a full stop shop, where I can be able to give them guidance so that took me to this level. So I think it's always important, and people forget to research and really see what's out there and know there's different titles when it comes to compliance. There's different compliance. We didn't even, I know we could be here all day, right? Research versus finance versus corporate versus medical. So what area do you want to go into and what do they require and which one? And know that you have to be passionate about it. If you're just looking for a check, you may not be happy. You have to really want to do this, love, have a passion for education, rules, regulations. Know that you're going to be reading. Education does not stop ever. I was like, whoever told me when I did my CPC, like I thought that was it. But no, you have to keep up CEU. So I think that's important.
Yeah, I would agree. I do think that if you're a coder now and you have an interest in compliance and or auditing, because they kind of go hand in hand together, take what you're coding, and a lot of people don't want to do this unless they're getting paid to do it. So you got to do some of the stuff sometimes on your own time. Take some of that stuff and go research it. So if you're coding a specialty, say you're doing urology, and I'm good at coding it, but are you good at coding it? Go dig into those policies. Go look and see what are the documentation requirements. Are you really meeting that? Figure those things out. And being that educated as a coder makes you helpful to the compliance and auditing people within your office or facility, because you can be the frontline person to say, hey, I don't think this is right. This doesn't look right. I noticed some discrepancies. Maybe we need to have an audit done on this particular thing because I don't know that we're meeting the requirements. But if you don't know those things, you can't do that. And that's just a good place to start from, to get real familiar with that. And sometimes coders don't do that. They just kind of get the habit of this is what we're doing and we do it all the time and nothing changes, but things change every day. So it's good to just kind of dig into it, and it gets you comfortable. And if you like it and you go, I kind of like doing this, before long you find yourself doing it on a lot of your own time just because you want to learn it. And that's kind of what I did. I learned a lot of things on my own time just because I wanted to know more. Right. And
you have to have a hunger for it, for sure.
Yes, you will.
I think that's what will set you apart from others, and how successful you are as well in the compliance world in your career, because you're not doing it always on a paid time. It's always, you're taking it to a park or a coffee shop, and you may hear it from your family and friends, like, why are you still on the computer? Why are you reading this? But you need to know so you can give guidance. And so that's important. And if we think about any certification that we took, they all start off with like a chapter about compliance, because it's in every certification course. No matter what you take, they're going to talk about compliance and rules and regulations. So, if you're interested, I think that would be great. We always need fresh eyes.
Absolutely.
So for those that are interested, do consider themselves, badass coders that want to learn or take compliance jobs, what are some of those titles that you look for? Because I see compliance officer, compliance specialist, compliance analyst. Like, what are some other job descriptions or some compliance related titles out there?
I think auditing. If you go into auditing, auditing becomes compliance, because to me, auditing is compliance. If you have a knowledge of understanding what to look for when you're auditing your own charts, because most coders will look at what they coded, especially when they get audited from for accuracy. I don't think this is right, blah, 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 blah. So if you challenge the accuracy of an auditor who's looking at your charts, then you're already halfway there, because most of the time you don't agree or disagree or whatever, then you're already on the way. So if you find yourself fighting with auditors and getting it right when they look at you as a coder for productivity, then you should start looking at a job for an auditor, because that's basically what it is comparing what's documented, what's coded, how it matches, and then moving on from that. So
yeah, I think there's starting off like in different areas, like Indeed, or different, whatever you're looking for when it comes to jobs, even if you're looking on LinkedIn, like those keywords, as you mentioned, putting audits, putting compliance,
Hmm.
because in different organizations, it could be the same role, but they have different titles.
Yep.
So I know John mentioned like compliance analyst, you have auditing analyst, and it's funny because the names may change and then the pay may change a little bit depending on where you're looking at also. So starting off with those keywords and maybe even putting in the certifications as well, because I feel like now I'm seeing so many, depending on where you're going, they may change it a little bit because of the pay. They may reword it something differently and then give you the role of a manager, but you're not a compliance manager. They have it as an auditor, but you're doing all that roles as well. So
Uh,
So I think definitely checking. And
yeah.
then looking in on LinkedIn and at everyone's titles, because everyone has something different. And you may notice that they're working in compliance.
I don't think I have anything to add to that.
Mm.
One that the top of my head is are there entry rules? I think I saw one time there was one called a release of information ROI. Is that part of compliance or is that just part of like health information? I mean, are there entry level rules for compliance that are out there? Where you can like work your way up.
So I think it depends who you work for
Yeah.
and the chain in command. Because it could be ROI that works for health information, but then they report to the compliance officer, you know? So that can vary. I think I always say you want to just get in where you can, depending on an
Get in where you
organization.
fit in.
Would you say?
Get in where you fit in.
Where you fit in, speak to people, work your way up if you have to, but find out what it entails, who can maybe recommend you. Sometimes it's unfortunately who you know and may not necessarily be your resume, but someone has worked with you and can be able to recommend you, um, as well as front desk. Like I said, I started off working front desk like when I was 16, and but that helped me and it started my compliance realm. And from that, I was like, no, I want to do this. And when I started doing coding, I love the auditing aspect. So I researched and I was like, I want to go into auditing. And when you go into audit, you're reporting to compliance. You're reporting to a compliance manager, a compliance officer. And oftentimes there's areas in compliance where you can work your way up even in that department.
Yeah.
And so starting off as a coder, or as a billing person, and then over time you decide, you know what, I like this. Let me see how I can elevate my career.
Agreed.
All right. Well, we've gone well past the hour mark, but any last minute comments or anything I kind of neglected to discuss?
An hour mark, I thought it was like 9. I mean, you can talk about compliance forever.
Have
And we didn't even touch on a lot. I mean, we touched on a lot, but there's so much. But
right.
yeah, I thank you for having us on. I think this was great. I'm
Mhm.
sure there'll be a part 2 where we talk about other things.
We'll probably come back to this one, because I have memory of a goldfish. I won't remember what's going to be talked about, in a week. So I might forget we did one. So we'll do it again.
I enjoy being a part of the in crowd with these wonderful ladies. I have been around for a long period of time, and you see a lot, especially when you've been in the field for 30 years, right? You and I think the more well-rounded you become in understanding every role of the front desk, and then insurance verification, and then charge entry, and then coding, and so understanding the revenue cycle piece, and then adding coding to it, I think to me that's a good way to get started with compliance, because then you understand all pieces and how it can be done and make a difference. So, but I'm glad to have been a part of this conversation.
Same.
I think the last thought I have is don't be afraid to ask questions. If you see someone with a certification and you're not sure, you can ask them how they attained it, do they like the role? Can they recommend anything? If there's boot camps, as we mentioned, some of us sat in Kimberly's Own recently, and that was helpful. There were some people there that weren't going to for their certification initially, but they decided to after they sat for the review that they were going to now go sit for the course with AAPC, or if they were going to do the CHC with ACCA. You know, it depends. So I think just starting and having a conversation that will help too.
Absolutely. Absolutely.
My last words.
All right. Well, I thank you guys for joining us tonight and hang around because I think there's gonna be some cake. And we're working on
Vegan cake because I'm vegan.
what?
Yeah, vegan 9 years. So I need some.
I'll see what I can scrounge up.
Thank you.
If I would have known, I would have been prepared. You know?
Sorry.
But we're still working on the episode next time. But I will announce that shortly. Hopefully, we'll get that organized. But I know we have some things on the horizon. We're working on hematology coming up the line. Hematology and oncology bonus.
Love
2 for
that.
1. That's right.
Ooh.
We'll get that out as soon as we have them. That's scheduled, and I think we have one more a bonus episode we're also working on. I do try to stick to talk about these roles like job positions, but we do occasionally wander off and forget what we're doing, and we start talking about individual topics, which we typically do lead to other people to talk about. But we're going to be focusing on cheerleading and mentorship. That's also one of the things we plan to talk about within the next couple weeks. So keep an eye out for that, and meet us in the break when we're going to have cake.
Ooh, yummy.